Okay, Protocol 6 is our fever protocol, and the EMT and advanced provider is very involved in this protocol. They will be breaking fevers that are greater than 100.4 Fahrenheit or 38 degrees Celsius. You'll notice two new medications here that we're going to be carrying. Of course, these are common over-the-counter medications, but in pre-hospital setting, fairly new: ibuprofen and acetaminophen. Okay, so let's take a look at the first of these two medications, and it is ibuprofen or Motrin. And for our EMTs, this can be administered to adults only. Let's talk a little bit about what ibuprofen is. It is a nonsteroidal anti-inflammatory drug, or an NSAID, and it has antipyretic qualities, or it can break a fever. Many of us know it as an analgesic or an anti-inflammatory, and many of us with children also know it as a great antipyretic. Some of the contraindications, however, to administering ibuprofen are hypersensitivity to the medication, severe renal or hepatic disease, and patient with asthma. And we're going to talk a little bit more about that later. Precautions when administering ibuprofen are patients with a GI bleeding disorder, a pregnant patient, and we also want to avoid ibuprofen in patients taking anticoagulants such as warfarin or Coumadin. Some side effects are anaphylaxis, rash, GI bleeding, nausea, tinnitus or ringing in the ears, and headache. And as you can see by the picture, the concentration we're going to be carrying this medication in is a liquid form in a small cup that looks similar to a coffee creamer at 100 milligrams in 5 mLs. So now that we know about the drug ibuprofen, we're going to talk about the dose. And for our adult dose, the fever, of course, must be over 100.4 Fahrenheit or 38 degrees Celsius. We're going to administer 400 milligrams PO. Now, as I said before, the concentration is 100 milligrams in 5 mLs, so you will be administering 4 medication cups to your patient. I talked about asthma as a contraindication to the administration of ibuprofen, and that is because of a condition known as NSAID-induced asthma, or non-steroidal anti-inflammatory drug-induced asthma. And research has shown in about 8 to 20% of asthma patients, the administration of NSAIDs may cause a severe asthma attack. So we want to avoid ibuprofen in our asthma patients. Okay, so the second of these two new medications is acetaminophen, more commonly referred to as Tylenol. And for our EMTs, this is for administration to adults only. As you see by the picture there, the concentration is 650 milligrams in 20.3 mLs. And this comes in a medication cup. It's about the size of a single serving yogurt cup. So let's talk a little bit about what acetaminophen or Tylenol is. Well, it is an antipyretic, and it has analgesic properties, but it is non-opioid. Some of the contraindications to administering Tylenol: first is hypersensitivity to the medication, and an intolerance to alcohol, saccharin, table sugar, or yellow dyes, and that is because of the way the medication is mixed and packaged. Some precautions when administering Tylenol: anemic patients, patients with hepatic or renal disease, chronic alcoholism, pregnant patients, lactating patients, and of course the elderly. Some side effects to Tylenol in your patients is drowsiness, rash, urticaria or itching, nausea, vomiting, and abdominal pain. Okay, so now that we've discussed acetaminophen, the indications, contraindications, some side effects, we're going to talk about the dosing. Of course, the adult patient fever must be over 100.4 degrees Fahrenheit or 38 degrees Celsius. If that is the case, for our EMTs, you can administer this, again, to adults only at 650 milligrams PO or 1 medication cup, as long as the concentration remains the same. Now, in this protocol, it states if ibuprofen was previously administered. Why that statement is there is because if the patient had self-administered Tylenol prior to your arrival, what you need to do is switch the drugs and then administer ibuprofen. And the same is true for if the patient had self-administered ibuprofen, then we would switch the drug and administer acetaminophen. Okay, so now we're going to talk about the pediatric dose of these antipyretic medications, ibuprofen and acetaminophen. And this, again, is for our advanced providers only. EMTs will be administering Tylenol and ibuprofen to adults only. So the pediatric ibuprofen dose, and again, the pediatric patient must be greater than 6 months old, is 10 milligrams per kilogram PO. The acetaminophen dose is 15 milligrams per kilogram PO, and the acetaminophen dose can be found in the medication reference section in the color-coded medication charts for pediatric patients. Okay, so Protocol 7 is our pain control protocol, and as you can see, the EMT and advanced provider has a pretty significant part of this protocol when it comes to treating an adult who is in mild pain. We have the option of administering ibuprofen or acetaminophen or even aspirin. There's a few things we need to think about before we administer PO medications to our patients. You need to ask the question, will your patient need surgical intervention for injury or illness, such as an open fracture or a fractured deformity? Does your patient have a headache or abdominal pain? If they do, we want to avoid PO medications. Again, ibuprofen should not be used in patients with known renal disease or renal transplant, in patients who have known drug allergies to NSAIDs, with active bleeding, headaches, abdominal pain, stomach ulcers, or in patients who may need, again, surgical intervention, such as the open fracture or fractured deformities. Also, do not administer acetaminophen to patients with a history of liver disease. So again, adult only for mild pain. The dose of ibuprofen is 400 milligrams PO, or acetaminophen 650 milligrams PO, or aspirin 650 milligrams PO. And of course, to give 650 milligrams of aspirin, that is 881 milligram tablets, which actually equals 648 milligrams. Okay, Protocol 8 is the pepper spray taser probe removal protocol, and we are going to focus on this during the skills portion of the protocol training.